Welcome, everyone. Welcome to the Ultimate Men's Movement. I'm Dr. Jack Rocco, your host. We have a special guest and an interesting topic today that really has intrigued me for some time, and I think a lot of people. Um, we're going to talk about some of those subconscious triggers that you hear about. You know, trauma, childhood trauma. And how they continue to affect your life. I'm in North Carolina now. I drove down last night and I started reading the book. I've heard about it so many times, but I got it on Audible. The book is called The Body Keeps Score. Who's the author? I should have known that. It's on my. Do you know the author, Susan?
No, but I can look it up.
Yeah, let me look at it real quick so we give proper props to those who need it and those who want to look into it. I think it's a fantastic book. It is, of course, now it's not.
Bessel van der Kolk. Bessel van der Kolk.
Oh, there we go. Yeah, he's Dutch. He mentions that he's Dutch, and
Yes.
it's a book that is well quoted and discussed in mental health situations, mental health environment, and it covers a lot. It goes into a lot, and for those who don't know or you're tuning in for the first time, my major in undergrad was behavioral neuroscience, so everything brain has always been a passion of mine, even though I went into orthopedics. Um, this is something that's always fascinated me, and I think the brain is one of the last frontiers, if you will, on in medicine, and they're making a lot of great progress on it. One of my classmates went into psychiatry, and she mentioned to me at some point that she loved it because, interesting as far as, you have heart issues until you get to heart failure, and then you have liver issues till you get the liver failure. But she seemed to think that the pathology and the nuances and the details of mental health and psychiatry was almost an endless array of pathology. And we brought back Dr. Susan Rich. We did a talk several months ago on fetal alcohol spectrum disorder. And Susan is out in Las Vegas now lecturing, and I'll let her tell you all about where she's lecturing and how this is a return for her. But Susan was fantastic. I started reading the book last night, listening to it, and I reached out to her today, and I'm like, "Hey, do you want to do this?" And she's like, "Yeah, by all means." So she could be down there with the one-armed bandit doing some gambling, but instead she's in her hotel room, interested in speaking to all of y'all about this topic. So, Susan, if you want to introduce yourself first and tell a little bit about what you're doing in Vegas, and then we'll jump into the book because I think it's fascinating. I think we could talk for days on this. So,
Thank you so much for having me back, Jack, Dr. Jack. Um, yeah, I'm here in Vegas for the second time giving a talk in 30 years. 30 years ago in March, I gave a talk at the Academy of Criminal Justice Sciences annual conference, and on the same topic, which is what happens to babies when they're birth moms, and really now we know dads preconceptionally drink alcohol. Um, but I am here this time speaking at the Nevada Psychiatric Association annual meeting. And I spoke virtually there in 2021. So this is my first time speaking in person at this particular conference. But the Nevada Psychiatric Association for 31 years has put on an annual psychopharmacology update for psychiatrists and other physicians and allied health professionals. So I'm here and basically get to speak tomorrow, and they put me as the last speaker of the day. But I don't know whether to take that this topic, which is prenatal alcohol exposure, talking about it in Vegas, it's like a really sensitive topic because a lot of their income comes from alcohol and of course gambling, but they want you to get, drunk so that you can gamble more. And actually in 1996, when I spoke, in March of that year. I did not, and I still do not gamble, but on the way out the conference center at the time, my mentor, Dr. Charlie Dean, he said, "Hey, Susan, here's a quarter. I know you haven't gambled. Just put it in the slot machine so that you can say that you did it." So I like popped it in, pulled it down. Of course, nothing came out. Uh, and I don't gamble. That was my one and only ever time. I'm also a teetotaler, as you know.
Oh,
Uh,
so Vegas is perfect for you. You're like,
yeah. I have no triggers for, gambling addiction or anything like that. And they're not going to get one over on me because I'm not drinking,
yeah.
so
That's one
anyway,
thing that I would agree with that. Gambling has never been something that ever made my heart go pitter patter. I've done a little bit with some friends just to say you were there, but um, I almost hope for I get yelled at by by some of the players for taking a hit when I shouldn't have taken a hit based on some algorithm. But so I'm going to start off by, um, with some of the basics of brain anatomy and function and why this is so important in embryologic development and how these things continue to haunt us through the years. You always hear all the kids, all these kids are talking about, oh, that's triggering me, that's triggering me. I have trauma, 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 and it's true. Like a lot of it, it's a variable scale of what trauma is, but the brain is basically made up of three general components. You've got your brain stem, which does all your basic functions. Breathing, hunger, eating, pooping, peeing. A lot of those basic elements that keep us alive.
but also our sensory neurons, all of our cranial nerves are on our brain
Correct.
stem. So our seeing, our hearing, our tasting, our touching, all of our sensory systems. And of course, the vagal nerve, which is really big in this book, what they talk about.
Exactly. And correct me if you will, but I'm going to give my basic orthopedic understanding of it, and you can go in deeper, of course. Um, and then above the brain stem, which the brain stem leads into the spinal cord and all the cranial nerves, like you say. And then above that, you have the limbic system, which is they I guess they consider the brain stem like your lizard brain.
Well, I
And
say
then
it's your inner emu. It's your
there we
inner
go.
emu. I don't like to think I have a lizard in me. I also don't
Yeah.
like to think I have a chicken inside me, which any bird, but emus, I can get that we have an inner emu, right?
Okay.
That's the brainstem.
There you go. And then over top of the brainstem, we have the limbic system, which is your emotional centers. Um, and you can go into more details about this, but at birth, the infant is pretty much all brainstem and limbic system. And the limbic system, from what I was reading or listening to in this book, is responsible for a lot of that prenatal and early bonding with the mother, some of the emotional centers
It's
of.
social, emotional, and learned behavior. That's why keeping babies on a really lovely little schedule from an early age, if you can get the rhythm of the baby right, if you can get in sync with that, then you get their schedule right. So it's learned behaviors. They learn to expect certain things at certain times. Emus are the same way, actually. They do go by learned behavior, but it's a mammalian trait. So
Correct.
the
Right.
limbic system is considered our mammalian brain.
Social. He was talking about
Yeah,
social,
socialization, emotional.
bonding,
Yeah.
emotional. And then, the thing that separates us from a lot of the other mammals and animals is the cerebral cortex. And, he talks about that, this really doesn't come online fully until around age 7 when you start learning language and how to use words, just a gross overall. And the cerebral cortex continues to develop up until the early 20s, correct?
Well, that's our neocortex. So even mammals have a cortex, okay?
Mhm.
They have a cerebral cortex that covers, because that's the insulation around everything else. And so even the brainstem in a lizard or a reptile or whatever, they have to have a little bit of insulation around that, right? And then
Hmm.
that just kept developing and developing. And as the mammalian brain developed out the side, which is, the limbic system, like you said, and deeper brain regions also interconnect with the limbic system. Then you have the cortical brain that keeps growing on top of that. And so primates have a fairly well developed cortex, but we have what's called the neocortex, which then wraps all the way around, and it's fully developed later because the interconnections from the central parts of the brain then wire into that as you get to be in your teens and 20s. That's why when adolescents are starting to come unglued and it seems like their nervous systems are just really frazzled and vulnerable, it's because all of those interconnections are happening and things are coming offline and online. It's like rewiring an old house.
Yeah, and it's also like, a lot of the times when, it's where a lot of the damage, if children are drinking or smoking pot or what have you, schizophrenia can sometimes come online, at around that age, defects in that or issues with that. Um, but it's why it's so important to, really care for that early brain in the young children, adolescents, early 20s. Um,
Even before birth, because our neural crest cells begin to develop in about the second through, say, fourth weeks post conception. And that neural crest becomes our spinal cord and brain stem. And then from there, it keeps developing as the baby develops in utero. And it's those midline defects that are going to be the most pronounced when you have prenatal exposure to alcohol.
Okay. Well, a lot of our audience is not are not physicians, so I'm trying to keep it basic, So,
Got it.
three general categories: the brain stem, the limbic system, the emotional, and then the outer human brain and cortex, where separates us and our thinking. But the issue comes to be is that the inner brain stem and limbic system are your subconscious, below your consciousness, and that's where a lot of this triggering comes. And people that he talks a lot about war veterans, and we've got a lot of war veterans in our network. That it stays with you, and that's the top. The title of the book, um, "The Body Remembers," is kind of an insight into what the book is about, how you go through these traumas, and a lot of it, the integration of the subconscious, its main function is to keep you alive, survival, and then bonding. um, and then you develop this outer brain, your personality, your basic self. And in general, when these traumas take place, they occur in the stem, especially in infants, because the neocortex and those other ones, they don't develop till later. And these are all evolutionary um, ad, advances that have come over millions of years. And they come online with humans, in an evolutionary fashion. So you think you're all grown up and big and bad, and then all of a sudden, like, you start getting these triggers. What is this anger that's coming out? What is this emotion that's coming out? And where is it coming from? And it turns out most of it's in the subconscious. And even any trauma that happens, the subconscious doesn't necessarily, it doesn't think very well. If you can explain a little better, but so that's where these things come. And it's like finding what those triggers are and why they happen, is where you come in, um, and how do you control it? How do you prevent those triggerings? How do you try to control them as best possible? So go
Well,
ahead.
I think,
Tell me
yeah,
a little bit about. Tell me. Just talk a little bit about who you treat and why this
yeah.
is such a big part of your practice.
Well, it's to be quite honest, I treat predominantly children, adolescents, and young adults, but a lot of my patients have significant trauma histories, either from having been adopted from Russia, the Ukraine, Eastern Europe, South and Central America, Southeast Asia. They come from orphanage situations or having been relinquished and that whole relinquishment trauma, but having experienced or witnessed really bad abuse in their lives. And many of them had been born with some degree of neurodevelopmental issues, which predispose them to things like anxiety, depression, PTSD. So working with, kids, adolescents, adults, no matter how old they are, insight into why these things are happening is the first step. Because if you don't have insight, meaning an understanding of where it's coming from, that's tricky. And I think I've shown you in my practice, I have a brain that I take apart and I show them the three different parts of the brain. And I show them the brain stem, which has the amygdala in the middle of the brain stem. The amygdala is the panic button. And that's what's being triggered into a fight or flight. That's like, if you were to press a panic button and everything goes, whoop, that's what it feels like on the inside of a person when they're triggered. So understanding where these came from. So let's say, for an example, a very simple trauma, which I'm not saying it's not traumatizing, but a simple trauma would be when they were two, a big dog from another yard came over and barked really harshly at them, and their parent came out and started screaming and further, scaring them. And then the parent grabbed them up and took them inside. That little thing right there might be enough to trigger a fear of what? Dogs,
Dogs.
right?
Mm-hmm.
And so it turns out in my practice, I do have dogs. I have two little dogs and a big dog. And so for a kid who comes in who may have a trauma of dogs, and they can't go to their grandma's because she's got this little toy poodle, they'll bring, the child. And a lot of times it's just as simple as first you start with, say, a cat. We have three cats that work in my practice. And, they pet the cat, they interact with the cat. And then we have two little dogs. One of them is so, so gentle. The other one's a little bit hyper. So you introduce a very gentle dog. You hold the dog, you let the child pet the dog. This is called a type of immersion therapy or exposure response therapy.
Like, would you consider that like desensitization to try
And it's, yeah, desensitization. So you introduce the thing that might trigger them, but in a way that's like a very gentle, approach. And for a kid, some kids are phobic of bugs for the same reason. So I had this one little girl who came in and she'd been put on a stimulant, and for whatever reason, after being put on the stimulant, she had prenatal exposure, and that was a really big part of it, I think. But she started developing a fear of any type of bug. And before that, she was able to go out in nature and enjoy herself like that. She was in fifth grade and all of a sudden developed this phobia of bugs. And so first I took a big bug book and I just had it when she came into the waiting area, sitting on the waiting area table. And I told her ahead of time we were going to do that. And I said she didn't have to pick up the book and look at it at all. It would be sitting there when she arrived at her appointment. And over time, we introduced the book into the office, and I would just hold the book and show her pictures of bugs. And these are like those, how they magnify the bugs and make them look really big.
Mm-hmm.
And so just looking at
Which
different
is petrifying to even grown-ups when you look at
it can be,
yeah, they look like
but
aliens sometimes.
yeah. And so showing her, okay, here's the bugs. And of course, we had stopped the stimulant and we were doing other things to help her with her anxiety and her sleep and things. But then over time, she was able to take the book home with her and look at the book. And by the time the spring rolled around, we then went out onto my farm and walked around, petting the animals, looking at the animals, and walking by maybe a bush that had flowers where there might be some bugs on it, or bees, or pollinators.
Mm-hmm.
And just being really calm and, you know, not me getting upset either. And that's part of the treatment, is to have a calm presence sitting with you and kind of talking you through that. But her understanding where that got triggered, and in her case, there wasn't like a precipitating factor. It was actually, she was started on medicine that caused it.
Hmm.
Um, for kids who have trauma from, say, relinquishment trauma from Russia, the Ukraine, those types of places, meaning they were in an orphanage, they got dumped in the orphanage because their parents had alcohol problems or, couldn't care for them. That's a real, it's called a primal wound, right? And
Hmm.
um, a lot of times, these days, adoption agencies teach people how to talk with their children about that, but the trauma itself, whatever they might experience, there's no place for them to kind of process, oh, from, as early as I can remember till age 6, I was drug around the streets of Moscow with my mother, who prostituted herself, and I had to go into these, hotel rooms and really terrible places,
And a lot
seeing
of people
my
don't
mother.
think that, not to interrupt, but like a lot of people don't think that the child's going to remember these things
Right,
necessarily.
right.
But
Well, and so what you had said before, you had said something like, "Oh, language development doesn't happen until age 7." Okay, well, and that's not right, because actually babies are hardwired from birth. Human babies are, primate babies are, little mammal babies are, even all the way down to ducks and birds, to connect with their caregiver. And that's why I've been able to raise these two
mhm,
emus, Bubbles and Big Bird, who are attached to me. Um, so, attachment happens, and they talk about this in the book, by soft eyes. So, soft, gentle eyes, not like this, but
mhm.
soft, gentle eyes, a soft voice, and a soft smile. So,
Right. So a lot of these things,
baby,
like you
yeah.
said, like they are, he talks about, age 7 being the time where the executive functions, and I'm just, using an example to,
Yeah.
that this
Well,
doesn't.
that's executive. Some things are coming online at those stages, but early on, the baby can see about 12 inches, which is from the mother's arm to her face. And it's when she's holding the baby nursing, or if you're feeding the baby with a bottle, either way, you should be looking at the baby, making facial expressions, making eye contact, having that interaction, that social interaction from a very early age. A mother who's depressed can't do that, or a father who's depressed. If there's a lot of chaos in the home environment, people aren't paying attention in those ways to the baby. But treating these things first requires an, like, for the person to have a safe space to talk about these things in. So creating a safe space in my case meant introducing mammals and also other animals into the therapy session, so that they sit and they pet the cat, or they pet the dog as they're talking. And as they start talking about the trauma, I don't require them to talk about any of it. A lot of it I gather from data that I collect before they come in, like their adoption records and their parent. I have a 90-minute parent session in the beginning, and I get a lot of information ahead of time. But I tell them, look, you've been through what 10 people in 10 lifetimes should not have had to go through.
Mhm.
And and um and look at you now. Look how strong you are. You made it to this point. You're resilient. So you give them strong, words to help them understand that yes, they are strong. They're not weak, and it was that got them through this. But the other thing they talk about in the book, The Body Keeps the Score, is that you're all of this trauma gets stored deeply. And in some ways, that becomes kind of like your inner child. There's another book that's similar, that's called healing the inner child or healing the child within. I think you and I have talked about that one before as well. But what happens with early trauma is you push down inside yourself, so down to the deepest part of yourself, really who you are. So your desires, your aspirations, your dreams, your longings, your beliefs, your motivations, your fears, your aspirations, all the things that is really what you've been since your earliest childhood. You push that down to protect yourself from further trauma. And it's the pushing down of that, then what bubbles up is anxiety. You see, because you're pushing down really even all of your emotions and you're not acknowledging that. So a lot of people will develop a mask that they wear around other people. And as they grow professionally or academically and they go on into their careers and with their lives and their families, they've got this child hidden deeply inside them that they've compressed. It's almost like, do you know how you do the shrink wrap to get stuff into your luggage, or if you're
Mhm.
moving and you shrink wrap it and you suck out all the air, and it's just that child is compressed so far down. And for a lot of people, they build walls around themselves, moats. They build, they put crocodiles in their moat, and they only let the drawbridge down for certain people.
But
And
some of those, like you talk about the emotion, like the facial emotions, when you do cultural, a smile is a smile, an emoji is like those
yeah,
things are, evolutionarily ingrained in us. And,
right,
as a young child, you're in an environment where you're being yelled at, you get these looks of disapproval, that you carry that with you, versus acceptance, different emotions. And, they said those are going directly into the brainstem. So you're right. It does, affect, oh, I'm bad. I always get this look, and then when you, in later life, you get a similar look, the look may trigger you or
right,
give
exactly.
you
And
give you an impression of who this person is. Ooh, this person is dangerous because they've got that look. Whether,
right.
some people have an RBF and that can be
No,
triggered.
I okay, so that's a very good point. Let's talk about this for a second. So the same way that babies are hardwired to start to imprint on the mother's face and the father's face and their voice. By the way, that starts in utero, the voice recognition,
Mhm.
the voice attachment. But by the same token, babies start to learn to read facial expressions and body language, and they pick up on vibration and frequency, everything like the heartbeat, like they can feel their mother's heartbeat in the womb. They can feel her blood rushing through her system. They're exposed to all of her catecholamines, which are the stress hormones.
Correct. Yeah.
Um, and so that can set the baby up for high degrees of stress as well. But through time, as the baby learns to start reading the mother's facial expression and body language, some mothers tend to, or fathers, mask their own faces. And so they will say things like, "Oh, um no, I'm happy. I'm really happy."
Right.
But then their
They
face
say
is
what they say
neutral,
the right
neutral or
things, even though the
negative.
emotions are disconnected. Would you consider
Right.
that like cognitive dissonance? How is that?
Yeah,
There's a
exactly.
disruption between how you feel and how you act, and there's a knowledge that this isn't real. I'm pretending. I'm
Right.
masking, or
Well, right. And the child reads through that, but then they in a way learn that they can't trust their own instincts and their own gut. These, our gut really is our first brain. We didn't talk much about that, but the whole
Mhm.
vagus nerve and all of the somatosensory neurons. You remember studying anatomy and neuroanatomy in medical school. We have more neurons below the neck than we have above the neck.
Yeah, the gut has more. The gut is has more knowledge, and they're interconnected. There's a mind
Right,
body. There's a mind
right,
body
because
synergy.
90% of the signals come up from the periphery and only 10% go down. but the peripheries also included, your what you see from the outside, you see, you taste, you touch, you hear. These are all peripheral signals coming up. Only 10% of your signals go down. So for a baby, as they develop, they learn to read the face of their parents, and they learn to either trust what their gut tells them or to not trust. And traumas can cause them to, not trust anything in the world. And therefore, they've pushed this child down. So I tell my patients, I say, look, and I don't do this in the first session, maybe not in the second or third. I do weekly psychotherapy with my patients, but I say at one point, the walls of your castle that you've built and you've so meticulously put brick by brick all around you, those walls are going to come down like the walls of Jericho. And but we don't want it to happen all at one time. You just have to first be aware that I see you in that castle looking out at everyone else. I see you.
Mhm.
I know why you have to be that way. And once the walls come down, that child within you, it's like having an egg that you've pressed down inside you. And now the shell has to break to allow that part of you that is your inner authentic self to emerge and fill you up. And that is how you become authentic as a human, is that you are no longer afraid to be authentically who you are. You don't have to hide that part of yourself and to be ashamed of it, or to um, push it down and act like it doesn't matter.
Right.
You can release
And
that and let it fill you up. And then you be authentic with everybody. You don't just have to let down a drawbridge anymore. There's no drawbridge. There's no moat. There's no castle. There's no facade. There's just authentically who you are.
yeah, and those emotions, there's the mind-body connection. I mean, it affects your health in every way, your immune system, the neuroimmunologic chain. Um,
Right.
but these, when you're having these trigger moments, it's not just in your head.
No.
Your catecholamines go up, your adrenaline, your cortisol, all these stress hormones are giving you the same reaction. And someone who's experienced extreme stress um, will relive those experiences as if, and he talks a lot about, you know, in a healthy environment, in an acceptable amount of trauma that you have digested and processed correctly, um, eventually over time they will extinguish a little bit. They'll go down. But in these extreme traumas or something if you raped or molested by a family member or child abuse where you're constantly hit, um, these connections only intensify over time, and it's as if like war veterans, when they're reliving a war experience, it's as if it just happened. And he talked, it was interesting. Like he talked about when, he treated a lot of Vietnam vets, World War II vets, and he describes two broad categories of reactions to the butterfly ink plots. And one was, you'd go through, and then they do a color one, which apparently shocks the system into bringing out some of these fears. And he's like, "What do you see here?" And he's like, "So many of the men who were studied show, will have flashbacks to, what do you see? I see my best friend's back of his brain blown out. I see his guts
Right.
and his intestines.
Right.
That's
Right.
not a natural thing. But even like the worst, something that was even worse was when they've completely lost any attempt to make a story out of this meaningless dot, and they don't have any emotions for it. We're like, I just see an ink dot. I don't see anything in there. I don't see a butterfly. I
Yeah.
don't see a
Yeah.
bird. I
Yeah.
just see ink spot. They've lost any emotional connection, and those people are really deep in their
Trauma.
cave of protection and what
Right.
have you. So, um,
Right.
and it you know, exacerbated by alcohol and stress and poor
Right.
sleep. Um,
Right.
what about do you deal with any war veterans? Any?
Well, so that's a very good question. So, and let's go back because I'm going to tie this together with what you'd asked before is treatment.
Okay.
So, many years ago, when I was a medical student, remember how we had to do all those clerkships in our third
Hmm.
year and our fourth year? So, I was doing my last third year clerkship at the VA hospital in Albuquerque, New Mexico, and it was a wonderful rotation. But my very first patient came in, a veteran from Vietnam, PTSD, um, who had just tried to kill himself because his wife had left with his children because he went on another bender with alcohol and just rageful and like belligerent, and she left. And so he tried to kill himself, and he came in, and I saw him the night after he came in, or the morning after, and he was very red in the face, just very angry, just telling me this story. And here I am, this, 30 something year old, hadn't been exposed to a huge amount of that. And I said, well, when I feel this way, I do this breathing technique, which it's been used, in medicine, but at that time it was like 1998, maybe. People weren't using mindfulness widely in psychiatry, but even in psychiatry, right? Now they use it widely in medicine. But I said, I do this breathing technique, and I showed him the technique. I did it with it. He said, yeah, please do whatever you think you need to. So I did this 7 minute, mindfulness exercise. And at the end of this, kind of deep breathing visualization, me talking him through the whole thing, relaxation technique. Um, I said, whenever you feel like it, you can open your eyes and, you know, you'll feel completely refreshed. And it's a little bit of like self hypnosis that you do when you do it. And because I don't open my eyes, I keep my eyes closed because I don't want them thinking I'm looking at them, right? And so I will look down at my hands when I first open my eyes. And then if I notice they're not moving, because some people actually fall asleep in the process, um, I'll say it again. Whenever you feel like it, you can open your eyes and feel completely refreshed. And when I looked up at him, he was just opening his eyes. His whole face was back to a normal color. It wasn't red anymore. His brow wasn't furrowed. He didn't look tense. He looked completely relaxed. And I saw him a week, well, after he discharged. I saw him every day that week, and then he discharged to the transitional housing unit. And I saw him on the elevator, like just the day after he had discharged. And he said, "Hey, Doc, remember that thing you showed me? I told the guys about it. Can you come over and do that with us?" And so I was able to go over, and for the next 6 or 7 weeks, every week, I would go over for one of these sessions for an hour with a group of these men on the transitional housing unit. And you'd be so surprised how many of them, after, because we do up to 20 minutes of these sessions, they would talk about trauma from, having gone through like alcohol and tobacco, kind of abuse, alcohol, drugs, tobacco, everything, and stealing from their families. One man at the end of one of these, mindfulness sessions, opened his eyes and was crying. Many of them were crying. And he said, I remember last year my wife had, given birth to a stillborn infant. We lost that baby. She's pregnant again. I'm afraid my drugs and alcohol have caused this problem. And they were able to talk about things in ways like the trauma they had caused for their families, in addition to trauma they had had, in ways that they weren't able to do before. And so I think taking them to that, or at least at the time, I had hoped taking them to that place where they could accept the discussion about the trauma and begin to process it and have insight to it, that they would go back to their transitional housing groups. The transitional community had groups throughout the day where they had to participate. and be able to process it even more. So it's as you said, it's a self acceptance, and then taking in a way responsibility for making yourself better, even in the face of the trauma.
Recognizing those and coming, taking the, recognizing the subconscious boiling up
Right,
and trying to put it back down with the conscious, you know, um, but a lot of people don't know that they're being triggered. They're,
right,
especially, I mean, we're a men's clinic. We talk a lot about men, and men are, a lot of times we say, you're allowed to have two emotions, either anger or fine. I'm
yeah,
fine. You take the abuse. And he told some stories that were really heart-wrenching. One of them was a guy who was in Vietnam, and he took his unit out into the rice fields, and suddenly, like, just gunfire burst out, and he sat and watched every single one of his team members, his unit, be shot, killed, injured, including one who he felt was, his first best friend, his first real friend. They were, close like this, and that they formed those war bonds. And then, so he had, and then, I mean, it was a heart-wrenching story. He said the next day, um, you have to move on. You're in the middle of war. All the anger that he was built up of what he just experienced watching all this. And then the next day, he was in another gunfight, and he personally shot and killed women and children and raped a
right,
woman. These are horrible things. So, he's not only carrying with him the things that were done to him, and as they say, hurt people,
mm-hmm,
that, the rage and the anger and the vengeance and
mm-hmm.
the comebackins poured out of him. And you're like, you can't imagine those things. And when you see that horrible humanity that you can be lowered to,
Right,
what's keeping that from happening again? I'm like,
right.
this guy was a regular, I mean, like, you would never, ever in a million years think that you could do some of those things. But,
Well, and let me tell you right now that there is a term, it's a diagnostic term called harm OCD. And I hadn't heard about this until there's all kinds of OCD, but harm OCD is one. And I happen to think it's growing in the population. And I happen to believe it's tied to trauma for a lot of people. But I think that, let's say that that gentleman who wasn't, he carried out his vengeance on, say, those innocents that you were mentioning. But there are plenty of people these days who they suppress their trauma to the point that, like, one young boy had been really brutally abused by his mom, and affluent middle class, family, and she would pull him by the hair. He had really bad ADHD, so sometimes he would choose to play his video games instead of his doing his homework, and she was like all over him about that, and would burst into his room, bang on his door, burst into the room, pull him, up by the hair of the head, drag him over the house to get him to the kitchen table. And one time she even kicked him, like he was running out to try to run out through the front door, kicked him by the front door, like just in the, stomach and all over his body, just kicking him. And so by the time he got to be in eighth grade, he had a little bit outgrown her. And so the point that she came at him, he shoved her and, really knocked the wind out of her, pushed her against a wall. And she never did that to him again. But it really imprinted on him this idea that, oh my God, I could hurt somebody. And
yeah,
because he had suppressed that anger, he developed this thing called harm OCD, which was where he started to be afraid that he would, like, punch his best friend, or like he would have images
it's
and
almost like a sense of compulsion. And
yes, it was
what are the
it,
two?
Well,
an
the
impulse and a
obsessive thought, it's the
yeah.
obsessive
Oh,
thought is
obsessive.
that
Yeah,
he's going to punch somebody. The compulsion began to be him actually asking for reassurance of his parents, especially his dad, who was he was very close to. Um, am I really going to do that? How can I keep myself from doing that? What do I do about this? What if I do hurt somebody? And so that I didn't see him until his last year of college, believe it or not. And he had already made it through high school, but he would have images of even with his girlfriend, like raping her, like, and he'd be afraid
right.
that he really did it, like thinking, oh my God, I
Well,
really raped her. But all they were doing is sitting across from each other at dinner,
yeah.
and he would have images of in his apartment complex at college, just going out into the hallway and like bashing people in the face for like walking by and like laughing and talking when he was trying to study, and worried that he had actually done that. He had never harmed anybody, but it's like the people who believe that they might have ran over somebody in the road, and they keep circling back to see if they find a dead body or an injured person. I don't know if you're familiar with that phenomenon, but
I can understand. Yeah.
yeah. And so the treatment for that is first, then going back. I mean, it's a lot of things, use medicine, but also then like kind of helping that person understand that, even though they have this rage in them and this, anger and this anxiety, it's all like bottled up, but being able to process it and
But it's there.
make reparations with that person where the trauma happened. So that was a lot of what he did. He actually went to a program to learn about that and to help him.
But when they're experiencing it, it is as if it's still happening.
Yeah,
You're
that's the
not in a safe
PTSD
place
component.
in an
Right.
urban community. You are back
Right.
in Nam.
Right.
I had an experience with this, and in one way, I was a little I don't want to say embarrassed, but I was with my son. I was golfing with friends,
Yeah.
and the one gentleman was a Vietnam vet, and we golfed, and he's a character, like a lot of these guys, and on the news, there was some report about, there was an airline delay and these people were left in the plane for 6 hours, 12 hours, whatever the situation was, you know. And, I said, we were joking, having a good time, had a great day. And all of a sudden he's like, "Phew, these people complaining about that. I can't tell you when I came out of Da Nang, and we waited in the plane and he was in Vietnam during the, a lot of, and he goes, and we got into San Francisco and we sat on that plane for 8 or 10 hours. And he started getting really emotional. And he's like, and these people are out there protesting, all these hippies are out there protesting. And we walk out and they're spitting at us and they're calling it. And at this point, he's like in full out tear
Right.
mode, which,
Yeah. Yeah.
was the last guy you'd expect to get emotional like that. And it was, like suddenly like the conversation got like, and he was reliving that,
Right. Of course.
as if he was walking off the plane and just,
Right.
horrible, out of nowhere because of a news report,
Mm,
and, plenty of movies out nowadays that I think
yes.
depict those instances
Right.
more accurately. I mean, back in the day, the war movies were John Wayne and, all the heroes and, this, hyper Hollywood, presented idealism.
And
Um,
those men in that era, they were shell shocked. It was called shell shock then,
mhm,
but they had no way of talking about it.
right.
It was only after the Vietnam vets came back that people started talking about these things in the public domain. And you're right, ever since, there have been more books written about it, and Hollywood has taken it on as illuminating it in some of the dramas.
Hmm.
Then we have a better understanding as a culture about it. But what's interesting, Jack, is that we now know that this doesn't just happen to war veterans, that
No, but
post-traumatic stress
it's a
disorder,
common, yeah,
yeah, that, there is veteran or, let's say military service or even police officers,
right.
and all of these civil servants who are, pretty much fire rescue, it could be EMT. There are all of these people put in these horrible situations. My dad was a police officer for 30 years, but he never talked in that, for that era,
They
he
weren't
never
allowed.
talked about,
Yeah,
yeah, these things. And quite frankly, if you did, you, oftentimes would have to go and see like a psychologist or a psychiatrist and be evaluated for fitness of duty, right? And that was
mhm.
their livelihood. So, but now we know it's also in children and it's in adults who have experienced abuse. And there's complex trauma and complex PTSD where they had childhood and early childhood trauma, and then they might be re traumatized in their adolescent years. It could be, somebody beats them up at school, it could be an personal like date kind of situation where they get raped or they get beat up. It could be, that they're, let's say, a person who's LGBTQ and they get beat up. And then later on, having another trauma happen to them. It's just cumulative. So complex
Yeah.
PTSD is a thing too.
Right. And I mean, it's like I said, we could talk on this for weeks. We're coming to the end of our hour. And I just think, in summary, I think it's, that if you personally have, behavior issues, if, drinking is the way you drown your sorrows, you drown your emotions, and those lead to, abuse. You or one of your family members, it's what would you recommend? I mean, it's you need to see someone, you need to get to the bottom of this, that's, especially if you've had a personality change, you don't feel connected to, your family, your friends, your relations. There's a escape or a going into the cave. One final note on, you start, you're embarrassed by your behavior. I don't know why I do that. I get drunk and this is what I do. Like, what do you recommend to people, especially guys? We're a men's clinic, and guys don't like to share these things. What kind of
Well, I think
recommendations? What kind of recommendations would you have on what people should do if they start to notice these behaviors in themselves or others?
yeah. Well, I think first of all, first, the awareness that they now have, then reaching out to, let's say, their primary care provider. I don't know where they are in the country. Let's assume that they're in
Yeah,
middle America somewhere, and there may not be the access to a men's clinic like your clinic, or there may not be access to even a mental health provider nearby. But
right,
if you could tell their primary care provider, and then today, not to sort of say that it's the best, but there are these groups like Talkiatry and these platforms, these mental health platforms you can get on. I don't know the names of any of them
what do you
off.
say, more online groups
They're
and
online. Yeah, there's support
telemedicine?
groups for sure, but there are also licensed mental health professionals that are on these platforms, and you might Google it to figure out what some of the names are, but
But
that
you also probably have to be careful because some of them may,
right, right.
there's
Right. Well, there are legitimate ones that have licensed mental health providers in your state that you can see online, but you can't see anybody online that's not licensed in your state is
right.
the thing.
But then
And
there's also a lot of, like the idea of coaches. Like anyone can be a coach nowadays,
well, but see,
and
you
it's a
need to be
fine
careful
line
about that.
between, pardon me?
Yeah, you need to be careful about that because these coaches are really for the worried well, what we consider the worried well. They don't have any underlying, and they'll tell you straight up front if you have an underlying mental health diagnosis, then they're not the ones to work with you. That
Right.
you need a licensed mental health professional. And, to be honest, I think, having a network of support So whether it be going to your clergy or going to your wife or your
Right.
husband or your minister, or let's say you go to an AA group, or Narcotics Anonymous, wherever it is that there is in your community a support system, you start with that, and
Yeah.
then you
But I
can,
think it's also less, like I said, but I think it's also less
yeah,
stigmatized now that, we
yes.
talk about it in on our website. I mean, I frequently, men's suicide rate, men's alcoholism, there's so many things that really um, are preventable or treatable in a certain way. The stigma has seemed to have lifted from a lot of it. So I don't think people need to, be adverse to it or embarrassed by it. I try to bring it up, in my clinic all the time. What do you do? Like, well, we also just want to hear about you, So I want to thank you, Susan, for taking this time while you're out there being important psychiatrist in Nevada. It's great to have you here, and you're always welcome back. We'll bring up some other issues, but thank you so much. And how do people
Thank
get
you for having me. Thank you so
yeah,
much.
how do people get a hold of you? What's the best way? Do you have a website? Do you have I know you do a lot of things with your farm and whatnot.
Well, I'd say just as far as my farm, we have a pretty cute Instagram, which is official Dreamcatcher Meadows. But my LinkedIn would be the best way to reach me professionally, which is just Susan D. Rich, MD, MPH on LinkedIn. And I'm not looking for new patients at
Yeah, we
all.
understand, but it's just,
But
give you some
yeah,
kudos.
yeah, if
Yeah.
it's a professional that wants to reach out, that way. My website for my practice is susandrich.com. But I have a book, and that's the one thing that you and I both promote our books. So prenatalalcoholexposure.com is the website for my book. So
Well, thank you. All right. Well,
thank you so much.
this has been another episode. Interesting. We hope we stimulated some thoughts and ideas. But this is another episode of the Ultimate Men's Movement, brought to you by the Ultimate Men's Clinic in New Bedford, Massachusetts. I'm Dr. Jack Rocco, and I thank you for coming, and we'll see you the next time.